can hear about the technology, but what is important from a clinician point of view is how this is going to be useful to my patients. Now, the first patient is a 31-year-old banker, and look at the prescription there. You can see he's got a very hyperopic astigmatic prescription. Okay? Now, to treat hyperopia is very difficult. Myopia is flattening a mountain. Hyperopia, you're going to create a mountain. Still today, there are laces, there are clinics in UK, they are reluctant to treat any hyperopia more than +2 or +3 diopters. But in AVC, we have been very good in producing good hyperopic results. So much so, when the wavefront came for hyperopia, we are the first one to give a data to Jonathan for technological laser for hyperopia wavefront treatment. I saw this patient day one, 6.5 in both eyes, 2020. This is a 3-month result. I thought, okay, this must be a fluke. I will see him again a week's time, 2 weeks time, 3 months time, 6.5. I never had so good result for hyperopic wavefront for the last 7 years. I was so impressed. It's both. It's a cut with the, it's a creation of the flap, the interlace, and advanced wavefront laser. Okay? So I called Tony to come and speak about his experience.
Mention anything specific?
No.
Hi. Okay, so my name's Tony, and I'm the 31-year-old banker. I was told I had to say a few words. I didn't realise it was going to be so formal, but I'm pleasantly surprised to see how seriously you take all this. So I got a referral basically from a couple of people that I work with about advanced vision care, and these people tend to have quite a high threshold for satisfaction. So I thought that if they thought it was okay, it couldn't be that bad. My background is actually quite scientific, so I'm a very sceptical person, and it takes me quite a while to get convinced of many things. I actually ended up doing a PhD in electron microscopy, so I know a little bit about optics and the way that kind of light travels through lenses. So I think I hit Gemini with probably more questions than most, and I think at one stage she was probably reached the panic button in her office to get me out. But I went through all the questions that I had with both her and Amit, and I think by the end of the session I was very, very pleasantly surprised by both the capabilities of what they could do and also the quality of service that I had. So I went through the operation. I think within a couple of hours after the operation, I mean, one of the eyes was near perfect. The other eye took a little bit longer to get on track, but after about, say, 2-3 weeks, it was almost there. And since 3-4 months in surgery now, and it's actually, I have no complaints whatsoever.
Okay, the next patient is a 30-year-old housewife, referred by a family member. I think it's a brother who had a surgery with us. But look at the left eye prescription. It's high myop. The right eye is okay, but the left eye is -10.25, -1.25. Normally, her cornea is thick, but it's optimal. So normally for this patient, I would have gone in the LASIK for her, or LASIK with mitomycin, or probably I would have recommended the implantable contact lenses for her, because her cornea is just optimal thickness. But with the intralace, we are able to cut 100 micron flap, thinner than any microcurtain can do. So I was able to do bilateral advanced aspheric intralace LASIK, and look at the results 6 months down the line. I just put 6 months down the line, and these are results, same results from the day one. See, my patients, I tell when you train the optom, listen, the first day you see the patients, if they have anything between 6'12", 6'9", binocularly, unilaterally, it should be okay. But there's a corneal edema, it will improve. But now, when I see my patient at day one, 6'7.5", unilateral, binocular, God, gee, this is working. I call up our next patient, Lucy.
I'd like to say it's very nice to see you all. Obviously, I wasn't able to before. I first heard of advanced vision through my brother, who also had a successful corrective surgery. As you can see, my eyesight was very terrible. I felt it seemed to get worse every time I went for an eye test. And I've worn glasses since I was 7. And I've tried sort of most contact lenses that are out there since probably about the age of 14. having really bad vision at times was very frightening. Not sort of being able to find my way around the house without reaching for my glasses in the morning. And I have 3 children, so being able to see was a big thing. So I finally managed to make the appointment, thinking that they probably wouldn't be able to do anything for me, because thinking my eyesight was too bad. But once making the appointment, and it all happened very quickly, but with lots of questions being asked and answered, and meeting Mr Pillai, which I've had friends go for laser surgery that don't actually get to meet the surgeon until the day of the operation. So that was really nice, very comforting and reassuring. But it took me a few days to kind of adjust and get used to my new vision. But it sounds a bit cliche, but my eyesight now is just 20/20, and it's amazing, and I can't thank Mr Pillai and his team enough for giving me a sight that I never had without using my contact lens for my glasses. So thank you.
In the first day, or within 2-3 days, the patients with this technology interlace and advanced wavefront aspirate, and they get amazing results. Okay, I can see now we are analyzing our data, the present data of this technology, and see how it differed from prescription, age, parameters, and sex compared with the microcartome. So that we will be able to present at some stage. Now you heard about this alternative treatments. So again, how does it help the patient? So this is our first patient. You look at him, 28-year-old male doctor. Okay, now somebody is a doctor, is a public health. And if you look at the left eye prescription, he is wearing glasses, and he is wearing balance lens on the left eye for his life. The right eye is the only good eye. Now we can't do laser because it's only one good eye. We can't do any other procedures. And he is finding desperately difficult to wear his glasses, expensive, vision is not good, and he's a doctor. So our first thing was, we do the amblyopic eye to see first, function first. So we did the amblyopic eye with the Hyperopic Toric ICL. And you see the results, 618, 618 unaided. Then we went and did the good eye, +8 -3, 90 axis, the 6/5 vision, and a 6/6 post-op. This is 3 months. Normally, we don't treat patients more than amblyopia less than more than 6'12". But this patient, we take an exception, and he's a doctor, he understands the risks, and you will understand this is changes entire life. You will hear from him. And I'm also pleased to say, this is the first Hyperopic Toric ICL in UK.
Last 10 years, I think, I started searching to get rid of my glasses, and the only thing available was laser, which I couldn't do. So loads of different ophthalmologists, optometrists, and they said that no, the refractive error is too high, and there is astigmatism as well, so we can't do laser. For the last 3-4 years, I think it's only recent that the implantable contact lenses were found out. And I started searching on it, but even then I was a bit apprehensive and a bit scared as well, because it's a pretty new technology. But it was just last year when a colleague recommended advanced vision care. She did the laser from here, and I searched on the internet and then contacted them because the implantable contact lenses was available there. I met Dr. Pillai, all the questions were answered, all the information was given, and this was done. I think it was last month, a few weeks ago, and everything is perfect. So I'm really happy with everything. Thank you very much, everybody, especially Dr. Garan, my surgeon. Every step was explained during the surgery, pre-op, post-op. Everything was very perfect. So really happy with that. Thank you very much.
Next is a myopic patient, toric ICL. And you look at the prescription again, you see high astigmatism, high prescription. We couldn't do laser for her because her pupil is large. You do the calculation, it is not viable to do laser for her. So we did a myopic toric ICL, and you look at the results. I have seen in my clinical practice the last 4 years, people gain 1 or 2 lines after ICL, okay, without any aberrations. So I called Moni Cox.
Thank you. Hi everyone. I just want to mention that I actually started off being one of those skeptics. So you can see it on the screen. I had, like, for my feeling, I was practically blind. But every morning I put my contacts in my eyes and I felt what it was like to see perfectly. So I was quite skeptical in terms of looking into any refractive surgery for my eyes. I've done quite a bit of research before I even approached a couple of those organisations. And I ended up doing a consultation with Dr. Pillai. And the one thing I wanted to really mention is that I was really, really impressed by how specifically that first consultation went. And I felt really impressed by how they made me understand what they were going to do to my eyes during the day of surgery. Now, during the day of surgery, I remember that I lied down. Obviously, I was well taken care of beforehand, but I lied down on the couch, whatever you want to call it. And there was this really, really bright light, scattered like all over the place. And you can actually sense as a patient, you can't feel the operation, but you can see the moment they shuffle in the contact or the lens, you can see that light becoming from this one scattered light into this really nice proper light. I still remember, obviously we were taken by the taxi back to the clinic, but after that I took a tube back home with my boyfriend, and it took about 30 minutes home for it, but I spent all 30 minutes pointing out what I could read. So it must be quite boring for him, but for me it was really amazing to see how quick the operation was. So you walk out actually being able to see, and it looks like you see through this like hazy, smoky room, which lasts a couple of hours. But the day after, I felt like I could have gone into work, so I took an extra day off just to not spend 8 hours behind my computer screen. But physically, you're able to do almost anything. So yeah, I was really impressed by that. So thank you very much to the whole Advanced Vision Care team.
There are people, baby boomers, they want a quality of life. All the technology, all the advancement in science is to improve the quality of people's life, right from stem cell or for artificial cornea, anything for the quality of life. The next patient is an example. Now, she had a cataract in both eyes. Look at her prescription. So we did a CL at the multifocal, expert is to Professor Philippa, and you can see the results. It is now 3 months. Look at 6.7.5 BCVA, and she read N6. Binocularly N5, binocularly 6.6. Remarkable results.
First of all, I'd like to say I've got a son of 50 years old, so I think it's a little bit out. I am actually 73.
I don't want to say that.
And it's 18 months ago since Professor Pillai did my eyes, and they've been absolutely fantastic. I can't thank all of you enough, all of you, for the sight you've given me, because at my time of life I think everybody thinks glasses are the thing, but I've proved them wrong. And the consultation with you, Mr Pillai, was the first start, and that really, really did set me off. And I knew then that I was in such good hands. You could have done anything. It didn't hurt at all. If you'd have shown me these pictures before, I think I went. Thank you very much.
Thank you. We take borderline grey cases. Ultimately, we have to help the patient. We can't just stick to protocol all the time. This is the example of the next patient. She's a 37-year-old IT consultant. She saw us through the web. Look at her prescription. Plus 6.5, plus 4.75, minus 1.5, minus 1.2 for astigmatism. Okay? Ideally, we can't do laser. But then we could go and do an ICL for her. But her anterior chamber depth, unfortunately, when you have a hyperopic prescription, is 2.5 millimeter. So we can't do ICL. So what do? Turn her away? Okay, could do that. But then you need to sit with her. Listen, what do you want? Or are you prepared to take some risk? We have a procedure which we don't do normally for patients less than 40, but we can do that for you provided you understand what you want. This is where consultation with the surgeon, talking to the patient, spending time is very, very important.
I'm glad I got it done. I was very scared. And as a student nurse, the only theatre I almost fainted in was eye theatre. So as you can imagine, having eye surgery was the last thing I wanted to do. But I'm glad I did. I must admit, I did go about 5 years ago, to go and get a consultation. And do you know what? I'm glad I didn't go with that person because they didn't make me feel comfortable. But you did. You and the whole team were fabulous. I remember we had surgery, and I turned around to you and I said, "Is that it?" I thought it took 4 minutes there, but it felt like 2 minutes to me, and it was like no time at all. I was back at work, like in the next 2 hours. Afterwards, I was on my BlackBerry, I was working, and then I went to the pub. So it was fine. I had no problems at all. Saw the halos, thought it was nice. They disappeared very quickly.
I think you must be hungry and enjoy your main course. Then we will take some questions during the course.